Hello, everyone. Great to be back here at Startup Tech Valley. Um, I'm Mike Riley. I'm the president and CEO of Peak Neurophysiology Group. We provide intraoperative neuromonitoring during brain surgery and spine surgery. So we were here in June of last year, and since then, for anyone that was not here, I will do a very quick recap. Sorry. I'll do a very quick recap of what exactly it is that we do. So intraoperative neuromonitoring involves sending a clinician into the operating room during a surgery. We put them in with special equipment, and they hook the patient up to different electrodes and run tests to determine if there's an injury to their nervous system during the procedure. So if there is a sign of an injury, we alert the surgical team and suggest a cascading series of interventions in order to reverse or limit that deficit so that the patient doesn't wake up with a new injury that they didn't have before going into surgery. So here we go. So this field's been around since about the late 70s, and in the last 2 decades, there's been a lot of problems that have hindered the progression and quality in the delivery of this service to our field. So the first is that there is no requirements for education and training of clinicians that are providing this service. And in addition, there's no licensure that is required at the state or federal level anywhere in the country. That's pretty terrifying, right? So this means that companies can basically, they can go out, take anyone they want off the street, train them according to whatever standards they want, and put them in the operating room where they can deliver 1,000 volts of electricity to a patient's brain. That's a legitimate statistic. We think that's a problem. Exacerbating this problem is the fact that there's a growing demand for neuromonitoring, but there's a shortage of clinicians. So companies are further incentivized to expedite the training process in order to get a body in the room to cover these procedures. The result is that the majority of surgeries now are being monitored by undereducated and poorly trained personnel, and patient care is suffering as a result of that. So I've been in the field for 8 years. I started this company to try to fix that problem. Our solution is to put advanced professionals with advanced degrees, and it's specific to a neuroscientific discipline, into the operating room. So folks with masters, PhDs, audiologists, into the room and provide them with a year-long fellowship training period. Prizes both, sorry, I can't get used to this microphone, both didactic and clinical components. In addition, we're currently working with larger volume facilities to help them develop an in-house neuromonitoring program so that they can, to the same standards that we have, so that they can turn what would otherwise be a significant expense into a cost savings. Our leadership team has grown quite a bit since June of last year. We've brought on Dr. Sebastian Fournier, he's our Chief Clinical Officer, and Dr. Lev Gridman, who's our Chief Medical Officer. We've monitored 382 procedures over 7 hospitals in 3 states, and 85 of those procedures, we identified signal changes where where we alerted the surgical team to a potential change in the patient's nervous system, intervened in order to prevent, limit, or completely reverse any postoperative deficit the patient could wake up with. We've also developed an in-house program with one of our larger accounts to help them grow and maintain a high-quality neuromonitoring program that they would otherwise not be able to receive. And we launched a sister company for operations in Canada. So we're currently servicing a large trauma center in Toronto, and in January of next year, we will begin neurodiagnostic testing preoperatively before they even come into the operating room in Quebec City. We've hired 2 clinical fellows. We have sponsored and managed a neuromonitoring conference in New Jersey. We've delivered clinical presentations at 2 international conferences and webinars. I've been nominated for board membership at our national society, and we're also currently developing a new test to protect vocal cord function during cervical spine surgery. So we're very pleased with our success so far. We've been doing this for a year and a half and doing really well, but we're really looking to expand our scope of patients that we're reaching in the capital region. Right now, we only have one small facility in the capital region. The rest of our work is in central New York, Massachusetts, Pennsylvania. And so we're looking for anyone in the audience today that might have currently working in or have know someone who is currently working in any of these roles. And if you do, please come find us after the presentation, and we will be glad to talk to you about how we could help service your patients. So that's it. Thank you very much. I also want to thank the Bull Moose Club and Troy Innovation Garage. Thank you. Any questions? Any questions? Yeah.
Why did you start?
I've been doing this for 8.5 years, and I was lucky enough to be trained by a really good company who was since sold to a very large company. And I've worked at 3 other groups that provide this kind of service, and I was quite disappointed at the level of quality that these companies were content with. So, I tried to fix it from within, but it was just not happening. So I had to go out on my own. Thank you.